So I think we can start. Mr. Benson, are we audible?
Yes, we are audible.
Okay. So let us start this session. So good afternoon from India and good morning to all other from other countries. Good afternoon to everyone. It's my great pleasure to warmly welcome our esteemed keynote speaker, Mr. Benson, a distinguished para-veterinarian from overseas, along with our valued colleagues and delegates from across India and around the world. We are honored to have such a diverse and accomplished gathering here today, bringing together a wealth of knowledge, experience, and perspectives. Today's topic is next gen advancement in veterinary care, which includes my clinical assistant and dosage calculator, which will be highly beneficial for practicing veterinarians across the globe. Your presence truly enriches this occasion, and we look forward to a meaningful discussion, insightful exchanges, and fruitful collaboration in the future. Thank you all for being here. I wish everyone a very engaging and successful session ahead. Now, I would like to invite Dr. Sambhavi to introduce our keynote speaker, Mr. Benson. Yeah, over to you, Dr. Sambhavi. Let me do one thing.
Thank you, sir. Hearty welcome from my side as well. I, Dr. Shambhavi, on behalf of Ashish Life Science Private Limited, welcomes you all in this webinar, whose topics is Next Gen Advancement in Veterinary Care. Today on the panel, we have Mr. Benson Ameda, President of Africa Veterinary Technician Association, registered to practice in Kenya. Mr. Benson is also the former Director of Veterinary Board, Kenya Veterinary Board, and is member of the panel of WOAH WPP expert. And before starting the webinar, I would like to address the title of the webinar, which makes the issues faced in conventional veterinary care involving record keeping, misplacing diagnostic results, incomplete information shared by the farmers, and above all, the problem of tracking epidemic diseases outbreaks. And since globally we are moving towards a AI generation which has enabled to tackle the various day-to-day tasks with ease, we veterinary practitioners are still stuck with the traditional means and modems. And following the challenges, the veterinary care system, I would request Mr. Benson to guide us towards next-gen advancements in veterinary care. Over to you, sir.
Thank you. Thank you very much, ladies and gentlemen, and welcome to this webinar by ALS. I'm always pleased, and it's always my pleasure to be amongst the veterinarians and veterinary paraprofessionals who are serving our communities. There is no doubt, and we all know, that in the year 2050, the population of the world will more than double. But the most unfortunate thing is that the task will be left to the professionals, the veterinarians, to ensure that the world will have enough milk and enough meat. And more even is that the veterinarians will be responsible for ensuring that the livelihood of livestock keepers and farmers, not only in Africa, but also in Asia, is up to date. For the veterinarians and veterinary paraprofessionals to meet this increasing demand, there is no doubt we have to think about the next generation advancement for veterinarians and veterinary paraprofessionals to be able to care for the animals, to be able to care for the humans, and to be able to provide for the livelihood. Next. So this provides us with an application that I will define to you this afternoon, and that's the ALS Care. ALS Care is a very simple application, simple to use, simple in terms of the way it is presented, but quite critical for us to be able to feed our populations in the next years. ALS Care app is designed to provide quick and reliable information for livestock and pet care and veterinary support. When we are talking about quick and reliable, us as veterinarians, we know that it is not just about treating animals. Prompt information, being able to detect diseases is what will assist in being able to take care of animals. And therefore, the key features of this is one, livestock and pet care information that is very critical. And here we are looking at the nutrition, preventive healthcare, and common diseases. Then we are looking at the feature of veterinary directory. Easily find nearby veterinary clinics and services. Because sometimes we may be near a veterinary clinic, but because we are not able to find it, we end up losing our animals, even our pets, simply because they are not attended to. Another feature is educational resources. All of us, however, the days we graduated are a long time, and therefore we need a library of information articles so that we can upgrade. Medical reference, quick lookup for veterinary and related information, very important for us veterinarians who are practicing in the field. Again, most important, product catalog. Sometimes we may have a product in our hands, but we are not aware that there are other products that are also available. And therefore, this application, one of the features is to provide for that. Next. So, ALS Care's application for better efficiency. As I said, and as I started, we need to feed our population. We need to be prompt. We need to be accurate in detecting diseases. And we need to provide cost-effective services to our livestock keepers. Because if the costs are not effective, if the costs are not affordable, then we will be making our farmers lose more resources in the process. So the application for efficiency enriches your knowledge. The veterinarians will have a situation where the knowledge will be enriched. Hassle-free dosage calculation. Remember the days when we could carry papers and pens. You keep on calculating and you're still not adding up. This is hassle-free calculation. Interaction with professionals, colleague professionals, and also interacting with the farmers. Farmers also need to interact with professionals. And imagine all this will be happening just at one stop through one application. Sharing knowledge with the community, disease outbreaks, hotspots, and and disease alerts. All these are information that is very, very important for our communities. And this takes us back to the public good diseases, diseases that are notifiable, diseases that do not only affect one farm, they move across. And therefore, if the community is informed, then we'll be able to control diseases. Get product information. It is not enough for us to know that this product X is an antibiotic, or product X is a product for deworming animals. That's not enough. What information do we need to have? What are the active ingredients in that product? So that when we are advising the farmers, we are advising from an informed position than a position that we are not actually sure. Farmers can share access with vets. You remember that the farmers of today are not only staying in the farm, they are also moving around. They also have some other activities, and therefore the access to farmers should be very prompt, and farmers also need to have access to vets, so that the farmer should not drive or walk 6 kilometers, 20 kilometers to get a vet. That's spending the whole day to save an animal. Keep updated about new products. When we graduated 10 years ago, 30 years ago, the product that we had there are actually not the ones that we have. Molecules are changing. And therefore, for us to keep updated, which are the new products and the ones that very effective ingredients. How will we be able to know that if we are not updated? Track recording of farm visits. You have visited 10 farms today, but you need to track the farms that you have visited. Which information did you leave behind? What do you need to do in that farm? When do you need to have your next visit? Those are things that as a veterinarian, you may not be able just to keep in your head or mind. You need to have them recorded somewhere. And locating vets and veterinary paraprofessionals for farmers, this is very, very important. Where do you locate vets and veterinary paraprofessionals within your community? Next. So the major benefits to farmers is, one, you get your product easily. You don't need to take more time. You don't need to hustle to get a product. It will be available because you are able to locate the veterinary products outlet. You are able to locate your veterinarian, and you are able to locate your veterinary paraprofessionals. And the next one, as just mentioned, able to locate your agrovet or the veterinary pharmacy. You are able to locate your the veterinarians, and get product information. Sometimes we think that farmers do not need product information. They need, because when it comes to advising or withdrawal periods, the farmers need to know exactly what kind of product was used in the farm. Very, very important for our farmers. Enrich knowledge, interact with professionals, and to be able to track your purchase history. Which product did you purchase? When did you purchase it? And how much did it cost? So that when you're purchasing another product for farmers, when the farmers are purchasing another product in the next 4 months, they should be able to check and see the same product was purchased 4 months earlier at a given cost. Now it is costing this. What other additives are in the product that were not in the other one? So this is very important for the farmers, and also help them know whether they are making profit or they are not making profit. There are also benefits to veterinarians and veterinary paraprofessionals. Next. And for veterinary paraprofessionals, reach out more customers. Vets and veterinary paraprofessionals are in business. We are living during times when most of the countries have privatized veterinary services. And therefore, when you open a clinic, you are in business. You need more customers. And to satisfy those customers, you will have a way that you'll be able to reach all of them at the right time. You get your products easily, again, from the manufacturers, from the distributors, and so on. Keep pace with latest developments, and this I've said, and I can repeat it again and again. We are having new formulations, and therefore the vets needs to keep pace. Knowing about the products is important. Sharing knowledge with the community. Imagine there's an outbreak of a disease in your community, and you are getting that information from the farmers. You never knew that, you never foresaw that after the rains or after some kind of weather conditions, there may be an outbreak of a given disease. You need to share this knowledge with your communities. They will trust you and they'll give you more business. Track your purchase history. Again, vets are also purchasing products. How much have you bought? How much you are supplied? For example, ALS, sometimes if you are doing good business, ALS can give you products on credit. But then how will you be able to know how much you are paying back? What is the balance for you to pay to ALS? So it's very important that you need to track that. Get invitation for technical seminars and webinars. And I think this is why some of us are here. We will be having many webinars, and for you to be invited, then you should be one of those persons who have been using this application. So how ALS Care solves their challenges, and that's the next slide. How LSA Care solves their challenges. Farmers have challenges, the vets have challenges, and the business product outlets have challenges. For the veterinarians, you will be able to make quick decisions. Quick decision making is critical so that you don't spend more time in thinking of how to make a decision. Easy access to dosage calculators, treatment protocols, all in one application, and product information. This will help the vets to be able to to treat animals faster and to be accurate. We are living at times when the regulators are also up in arms. They are saying if the farmer complains, then the veterinarians have to explain, what did you do? How did you do it? Was it accurate? And this is an application that will help our veterinarians to make the right decision and then provide accurate treatment. Better case management, again, another issue that is critical for us veterinarians, and the digital records of farm visits, important, animal history, and treatments improve follow-ups and outcomes. For the veterinarians, again, we are talking of time efficiency. Sometimes in some parts of Africa, the veterinarians spend more than 6 hours traveling to the farms. Can you imagine more than 6 hours you are just traveling? So you have very few hours to be in contact with the farmer. The rest of the time, you are either riding your motorbike, you are walking to the farm, or you are driving to the farm. So the vets have very little time available to interact with the animals. So if you can have a way that reduces manual calculations and paperwork, allowing vets to handle more cases and effectively, I think this is something that the vets would love. What about the farmers? We are talking of improving animal health. That's very key to a farmer. The animal have to be healthy so that it can produce. Timely guidance and correct treatments reduce treatment risks and improve productivity. If you can have more productivity, the disease risk is removed, then the farmer will be on holiday. Easy access to expert help, I think I've mentioned that. Farmers can connect with the vets and veterinary paraprofessionals to get reliable and accurate information. Record keeping, because sometimes, again, for those farmers who get credit or who have insured their animals, how are you able to track your livestock health? The insurance firms will be interested to know, when was the animal treated last? How was it treated and what was the case? This is an application that cannot be tampered with. And the insurance company will be able to see and say, yes, you are keeping your records, and therefore, if the animal loses lives or dies, they'll be able to pay you without any more questions. What about to agrovets and veterinary shops? Instant AI-powered responses, clear information about veterinary products, customer trust. When the customers trust you, they'll always be lining up in your shop, in your agrovet, to buy your product. Even if you are selling the same product like other outlets, but they'll trust you more because of the applications that you are using, the information that you give them, and the guidance. And consistent service quality. It is not about quantity anymore. And this can only be provided by data insights, and demand patterns can help stock the right products and increase sales. So if you stock products that are not on demand, at the end of the day, the agrovet, the business, we lose. So if you can be able to track disease patterns, and you're able to have the insights and how farmers are demanding from the records in your app, it's very easy for you to request for supply of the right products. And therefore, the problems in traditional vet practices, and this is the next slide, when it comes to problems in, just move, problems in traditional vet practices are as follows, and this one we meet them every day. Some of us have practiced for many years. I've personally practiced for more than 37 years in the field, and I've practiced again for more than 6 years as a regulator. And therefore, these are things that we see daily happening: poor documentation, incomplete or manual records, missing diagnosis, tests, or medication history. You have gone to a farm and you're trying to remember which drug, which product did I use in this animal? Which product did I prescribe to the farmer? And if you are not able to do that in real time, the farmer will lose trust. And maybe that's why farmers are changing veterinarians. Today they are with you, the following day they have gone to another vet or a paravet, the other day there is somebody, because of this trait. We are not consistent. Simple, poor documentation is something that we need to deal with. Lack of patient tracking. I know, and this happens a lot in the field. The farmer calls you and tells you, can you go to my farm? The animal is sick. Which one? The brown one. So there are many brown animals. So when you go to the farm, you think that it is the one that you had treated or the one that you didn't attend to. So when you reach the farm, the first animal you find lying down, you are just assume that that's the animal. And you tell the worker to restrain the animal, you treat the animal. Then later in the evening, the farmer tells you, that's not the animal I wanted you to treat. You have treated a wrong animal. You are not able to track your patients. You don't know which ones. And this is not because we like it as practitioners. It is a big challenge because of the number of animals that are there for us to take care of. So there's no centralized health records. Difficult to track the history of animals unless you keep asking the farmer. But remember, the more questions you ask the farmer, the more the farmer loses trust, leads to misdiagnosis and repeated treatment. You keep on treating the same animals simply because you are not able to track some of the records. No disease tracking tools, no geomapping or outbreak tracking. For those of us, maybe the paraprofessionals who work in the countrysides, landmass is big, you travel, you can't remember where you treated the animal. This is an implication that gives you the real geolocation of where you have attended to the animal. So even when you are giving a report to the public veterinary officer, that report is accurate. The report was at a given and a specific location, and that will assist even the public veterinary officers to be able to detect disease occurrence, disease incidents, and even to know the hotspots. This has been lacking. It is a problem. No disease tracking tools, epidemic pressure, sudden surge in cases during outbreaks, limited vets versus demand, of course, I've said that, and delays in care that also translates to high mortality and losses. And so we are therefore giving issue faced by veterinarians. What are the issues that are being faced by the veterinarians? Next slide. So when veterinarians wake up in the morning, these are things that bother veterinarians. These are things that veterinarians must have at their fingertips because these are the things that they'll be dealing with on daily basis. Even if the animal is sick from foot and mouth, the veterinarians must be concerned about the breeding, the nutrition, the records, the finances, and the reports. So these are very, very critical issues for veterinarians. For breeding, we are saying that what are the AI records? Heat cycle alerts. We have cases where you serve the animal repeatedly, the farmer pays for the cost, but the animal is not conceiving. This is because we are not able to do the right breeding management. Feed and nutrition tracking. Feed is not managed well, causing poor animal health and low milk. Remember, when during clinical sign recognition, when you are diagnosing, there is the first element of history. You are asking the farmer what might have happened. After that, you look at the environment, you look at the feed traps, you look at what the animal is being fed on, the milk, and for you even to know about the low milk, the color of milk, the taste of milk, and the smell from the milk, then feed and nutrition is important. This must be tracked by all of us, the veterinarians and the veterinary paraprofessionals. And records cannot be left out because records are not maintained normally and they are not maintained properly, and important data is lost. Remember, you have gone to so many farms and you cannot be carrying all those files every day on your motorbike. Again, you don't know the farmer you will meet on the way. So the farmer you are meeting on the way stops you and asks you something about his farm. You didn't know that you'll meet him. You didn't carry all the files, the box of files. How will you be able to advise the farmer? Very critical. And these are issues that are addressed by the application we are presenting today. Financial tracking, we are in business. How much have you spent? What are you getting? What is your income? If you are to pay tax, how much do you pay? And are you making any profit? Or you are just serving farmers and then later you start saying, oh, veterinary work is not a good job, you don't make money, but you are the one who is not keeping the right records. Reports and insight, no proper reports, and this happens also for the veterinarians who are supervising veterinary paraprofessionals. You are supervising 10 of them. They don't give you accurate reports. And if they give you, the reports are not even in the right way. Some of them are written differently. So issues of reports and reporting are critical. And these are issues that affect vets on daily basis. So what are the pathways, therefore, for enhancing veterinary care? What do we do? What are the pathways? And one, as we have now started seeing, digital animal health records. We have to go digital. Can you imagine you are on holiday? So long as you are with your phone, you have all the records because they are in the cloud-based. You have data wherever you are. You are driving, you are walking with your family, you are on holiday, but you still have that information. Imagine meeting a farmer also on holiday. He or she wants to ask you something. You have the information. You don't need to go back home. So digital animal health records is critical and it's very important because they are safe. They cannot be rained on. I remember those days when we were riding motorbikes. You are rained on and all your papers have been rained on. You don't have records. So do you blame the rain? No. Let us move forward and digitize our records. Accurate diagnostics. We need to be able to analyze the past reports. How many times have I attended mastitis in this farm? And why? Why is it this farm that's having this kind of mastitis? So these are very important, and this provides you with the ability to analyze reports, faster and accurate decisions, so that you don't keep on treating. You find a way of assisting the farmer after you have analyzed your reports. Disease surveillance system, real-time data collection from multiple farms, and central dashboard to monitor outbreaks. So real-time data collection is important. we have a situation today, and this one I can also say because I've seen it, where non-governmental organizations, governments, they set aside a month or so. They select a few veterinarians and veterinary paraprofessionals and then tell them, can you collect this data? And we will be paying you this much for only 1 month. What happens the other month? So this is a situation where there's real-time data while the veterinarians is working, data is being collected, and anytime you need to refer on that information, any time of the year, you will be able to get that information at no cost. And finally, monitoring and productive status. Monitoring productivity status, what the milk production, meat production levels, disease and recovery rate monitoring are quite important, and this will be able to be achieved. This is the way to go. And so when we look at the general versus the advanced veterinary care, generally, we just in bullets, manual record keeping, that's the general way, what we have been doing. Now we are moving towards digital and centralized records. Fragmented data across sources. You have fragmented data. Now it's unified in one platform. Limited visibility of animal history. Now is real-time access to complete health data. High risk of errors and misdiagnosis. Now we are moving towards improved accuracy with data-driven insights. Remember, when you misdiagnose, actually the farmer is losing, you have lost your time, and the regulators will also be on you. So I know vets and veterinary paraprofessionals do not like to misdiagnose, but it happens. So why can't you move to a step where we'll be more accurate and with data-driven insights? Slow response to diseases and to outbreaks. Now let's move towards faster response, and we are talking about up to 30% quicker. How do you respond to diseases? Diseases can be detected, reported, but if the response is slow, then why report? Why do you need even to detect a disease? Because the response is slow. Inefficient workflows. Now we are streamlining it, automated process. Difficult tracking of outcomes. You may not know the recovery rate of the animals you treat or you attend to. Now we want to monitor that very easily and analytically so that you also save time. And so that takes us now to bridging gaps in veterinary care with technology. We have to bridge gaps in veterinary care with technology, and that's the next slide. Veterinary doctors play an important role in improving animal health and productivity. I think that is not debatable. That is given. But they face daily challenges like managing many animals, poor record keeping, and feed level issues. These problems reduce efficiency and increase workload and stress. Because you are managing many animals, your records are not kept properly. And the field issue, the rains, the terrain, the nature of farmers, because farmers are also not the same. Others are harsh, others are slow, others want you to do more. There are a lot of challenges, and then you will find that the workload and stress goes up. So a simple digital solution can help vets easily manage records, track animal health, and make faster decisions. This improves efficiency, saves time, and helps provide better care to animals. So when we are talking about ALS Care's application offers, this is what the application offers. You want to save time. How will you be able to save time? my clinical assistant. Remember, you are in the farm, you are alone, you are being assisted by the farmer, but next to you, there's also another assistant who is supporting you in the work you are doing digitally. And number two, dosage calculator. It is not that we don't know how to calculate dosages, it takes time. Animals are not the same weight, animals are not the same, environments are not the same. So the dosage calculator will be able to assist with highly efficiency when you are at the pen side. So we move to the next step, and there is a video here. I don't know whether it will play a very short one. Can you play the video? It's a very short video, ladies and gentlemen. There's no sound? Can you get the sound? Okay, okay.
Mr. Vincent,
Yes?
are you able to hear the voice of video?
No, let's just continue. Let's just proceed. If they are
Okay.
hearing, that's beautiful.
Okay.
So the next slide, Dr. Sumit.
Yes, yeah. So this is the QR code, and this is for downloading the ALS Care app. And there is a small announcement we want to make on the part of ALS team, and that is that anyone who uses the QR code to register themselves as veterinarians or para-veterinarians in the ALS Care app will be tracked, and three of the lucky winners will get a token of appreciation from the ALS team side. So I think that people can start scanning the QR code and downloading the link. Thank you so much. Mr. Benson, you can continue now. The announcement is over.
Thank you. I think let me give you 1 minute to scan the QR code, because wherever there are gifts, even me, I would like to get one. Let us scan the QR code and then register. Yes, so let's just move to the next slide. How to download ALS Care application. This one we can also do it from other sources. You open the App Store or the Google Play, you search for ALS Care, and then you tap install or get to download the apps, and you download it. So how to sign up ALS Care's applications? How to sign up? Again, here is quite simple. You open the ALS Cares application, sign up, as you can see there, enter your details. The details is simply the email, name, and phone number. Create a password, as we are doing on the screen. agree to terms and conditions. Agree to terms and conditions. Then you will have signed up. And this is something that if you find difficult, we are also available. You can just link up with us or our agents wherever you are, and you will be assisted. Then logging in. How to log in ALS Care? Open the ALS Cares application. You tap login, and then enter your email and password. You are there. I think this is one of the most important, productive applications, but also easy to use. It is very, very easy to use. Now, how vets and paraprofessionals can add a farmer in clinical assistant. Remember, I talked to my clinical assistant. Now, this is where my clinical assistant is. I'm working with my assistant in my phone. So how vets and paraprofessionals can add a farm in clinical assistant, just move to the next slide. It will be so that I explain from there. So the first step is click on my clinical assistant. As you can see on the screen, after clicking on my clinical assistant, it will take you to number 2, where you will see my farms and reports, and then click on my farms. When you click on my farms, it will take you to number 3, where it will be asking you ALS managed farms or other farms. So you click on other farms because you want to add farms. When you click on other farms, down there you will see add farms. Tap to add farms. Because already you have other farms, but you want to add farms. After clicking add farms, it will take you to number 5, where I drop down. So fill in all the required details. Here we are talking about the farm name, the farm address, the farm owner. Down there, you may also have a manager emails and the farm manager. Sometimes the farm owner is the farm manager, so there's no problem. Just do that. And then you will have added a farmer on your list. So next slide, just move my clinical assistant benefits. And this is the summary of the benefits. Efficient visit and schedule planning. You will become more organized. You are a planner. You plan. Everything is set. Better planning of visits. You know which farm to visit, on which date, and what are you going to do in that farm, the activity. Both for the week and for the days. Digital records, less paperwork. As I've said, not carrying files anymore, not carrying black books or papers. You have everything digitally. Simple treatment and hard tracking. You are able to treat simply. You treat all your animals, you track them, you ensure that the farm's animals that were treated and the history is actually at your fingertips. Easy reproductive and vaccinations. Easy management of reproductive, and there also we were talking of breeding, vaccination activities with improved workflow. Which animals have been vaccinated? When do you need to vaccinate again? Is there a booster or a repeat vaccination, and so on? So those are the benefits of my clinical assistant. So next step, we are looking at how to calculate dosage easily. How do you calculate dosage easily? You will not need another application, just the same one. And if you look at the same one, Up there, you are seeing my clinical assistant. Therefore, down, you just click on dosage calculator, how to calculate. So dosage calculator, let's just go to the next slide first. Let's go to the next slide. Yes, you click on the dosage calculator. It's just on the same application, the same page, no hassles. You click on the calculator, it will take you to the next step where you select animal species. Do you want to calculate for cattle? Do you want to calculate for companion animals? Do you want to calculate for poultry? Do you want to calculate for sheep and goats? So it will ask you that very simply. And then the next step where the third step is, when you have clicked for livestock, then you will select the product. Which product are you using? The product will definitely drop. So all the ALS products will be on the list. So you just say, you select the medicine you want to use. After clicking on the medicine, then you write the weight of the animal in kilograms. So you have taken the weight of the animals, or you know the weight of the animals, and then you will get the accurate dosage instantly. Sometimes with this calculator, when there's a product that the medication you want to give for poultry, for example, the ones you give through water, and you want to give 100 birds, for example, 100 chicken, then you just write the number of chicken, 100. Then the system will calculate and then tell you the approximate dosage that you'll need for the water is this one. And then you just do that simply without much hassle. So the next step is, so you'll get the accurate calculation. The next step is dosage calculator benefits. Instant and accurate dosage. Remember, sometimes you have traveled to the farm, you have done everything, the right diagnosis, but you only made a mistake during dosage. Then again, the farmer has lost time, money, and you have also lost your time and resources. So why can't you go to the next step? Instant and accurate dosage. Time saving for veterinarians. It saves time. No paperwork, no writing, no thinking about all those things. All in one smart dosage application, one app for complete smart dosage solutions. And then all species treatment. This one doesn't support only cattle. It supports all species of animals. We are talking of chicken, companion animals, dogs, cats, sheep, and goats. You can actually get it from the same application. And therefore, you don't need to look for any answers or solutions elsewhere. Next slide. So the future feature addition, smart weight detection. This is something that is not very easy to believe, but this is the future. The future is not long future. The future is from tomorrow. ALS Cares app is going to introduce an advanced feature that allows users to estimate animal weight simply by clicking a picture. You just click a picture and you get the weight of the animal. Using smart technology, the app automatically analyzes the image and provides quick and accurate weight results. Just using the picture, and this will be in the same ALS Cares application. How this will work, you click a photo of the animal through the app. AI-based system analyzes body size and structure. Instant displays estimated weight is given. So for the veterinarians and the veterinary paraprofessionals, remember technology, we are in the world of technology. and things are moving very, very fast. Some of the farmers may be ahead of us in other areas. We should not allow the farmers and the people we serve to be ahead of us when it comes to animal health technology. We need to be ahead of them. However, how slow it will be, this is the way to go because we will command respect. We will get a lot of trust from the farmers, from our colleagues, and even from the people we work with. Next slide. So, thank you very much, ladies and gentlemen, for your time. It was very, very good talking to you. We will be holding more webinars, and this was just a start for this year. We will be holding more, and as Dr. Sumit has said, the three will be receiving a gift. If we find that there are more, then I may also decide to add another gift from myself so that we have more gifts for my colleagues, practitioners, and professionals. Please also remember to share this information with other colleagues who might have not gotten time to attend. Thank you very much. Thank you, ladies and gentlemen, and thank you for your time. Let me hand over to Dr. Navneet Singh.
Thank you, Mr. Vincent, for such an insightful presentation. It really helpful to veterinarians for their daily practices. If they will download this LS Care application and then they can use the My Clinical Assistant and dosage calculator. It really helpful in the field practice. And it also organize them. Thank you very much. Now, if anyone have any question, they can put their question, their question in question answer session, right? Because chat is not enabled, right? Right. Yeah. So if any have any question, yeah. M. Salu, Miss Dana want to ask. He has raised his hand. There are two attendees who raised the hand. Enable them to say something. Yeah. Who attended? Okay. Now, M. Salu, Miss Gana can raise your question, please. Even you can put your question in question answers session.
Hello.
Yeah.
Yeah.
Am I audible?
Yes.
Very.
Okay. Thank you very much for the timely coming title. Saying this, I have some questions. I am from Ethiopia, Debre Tabor University.
Okay.
Veterinary Science School.
Okay.
So here we have veterinary clinics and drug suppliers, and I have also somewhat hints or introductions about the LS app, because we are familiar with the pharmaceuticals that comes from LS company here in Ethiopia, as well as here in Debre Tabor. Scientists have some questions on this app. I have seen the app has so many features. One of among those features, one is the dosage calculation. So in this feature, I think the feature is limited to some drugs, some. So, is there any possibility to calculate the dosage for vaccine? There are different vaccines that may be used for livestock. For example, we can take a Newcastle disease vaccine or Marex vaccine or another vaccine or any other drugs. So can we calculate for those supplies in addition to the drugs which are produced from LS company?
Okay.
This is my question. Thank you very much.
Yeah. Thank you, M. Salu. Your question is valid, but still we don't have this feature included in our ALS care application. But yeah, in future we can incorporate as per our discussion. We can incorporate this vaccine section also for important vaccines for what you have taken the name, NDB, IB, IBD, like that. So yes, yeah, we'll work on that. Thank you.
Thank you very much. Okay.
Now T2 James, yeah.
Yeah, thank you very much. Can you hear me?
Yes, yes.
Very well, Tito.
Yeah, thank you very much. I truly appreciate. Thank you, Ben, for a very wonderful presentation. It's really very informative, and the entire LS care team, and it's really wonderful. I have one question, especially from the app in terms of weight estimation. When I'm getting a picture, should I mind about the distance where the animal is, so that I have maybe I maximize the accuracy of the right weight
Yeah.
for the animal, or the distance doesn't matter. I don't know how you have trained your model to make sure that it brings about a more precise weight of my patient. Thank you.
Thank you, T2 James. Yeah,
Just
we are working on that. That is our future plan. Still, it is not there in our application, but yes, there are some AI-based tech available in the market that some European countries are using that thing for calculating the weight. And yes, it will measure the length and girth of the animal as per the whatever picture will be taken, and accordingly it will calculate the weight. And that will be very much precise. It will give the result approximately plus minus 5%. We have seen that application which is being used in the European market. So most probably in upcoming days, we will incorporate this application in our ALS care application. So it will be helpful for you to weigh the animal in the field. That will be easy for you to give the dosage in accurate quantity. Thank you
yes,
for
and also just to add, Tito, I think that's a very important question. And as I said, this for future, but it's AI based. Remember, the application will be able to calculate the distance between you and the animal, and then also get the calculate the size of the animal as per from what you have from the distance you have taken it, and then get the weight. But also the distance, I think it should not be a very abnormal distance. And you also understand, if you're a practitioner, you will be in the farm, and therefore from whatever distance you will be able to take, because some animals you cannot be very close, or you want to get the weight of the animal without restraining the animal. This application will be able to get you that. And therefore, the distance between you and the animal will be calculated as the weight is being calculated. But that's a very good question, even for us to start watching. Thank you.
Dr. Sambhavi, say something.
Yeah. So the apps that are using to calculate the weight of the animal, there is a specific green light, or there is a specific shutter that comes, and it signals to red or green upon reaching a certain distance between animal and the camera. And so the weight is measured, the distance is measured by the camera itself in the AI, so it helps to get the weight and distance accurately. This is the European companies are already presenting that, and we are going to incorporate same feature with more defined form in our app in the future. Yeah, ALS Cares app.
Okay, thank you very much. That's really great.
So you will
Thank
get the signal where to stop, when to stop, and when to click the picture. So it will be all AI based, sir.
Yeah, is this okay, T2 James?
Are you satisfied with the answer?
Yeah, it's great, and I'm really truly excited about it because sometimes we deal with the wildlife, and maybe you don't want to go into a very close distance, and all this I think
Yeah,
is coming up, an interesting aspect part of it, and I try to appreciate the advancement in this technology. Thank you.
We are working on that,
absolutely.
and soon you will get this feature in our ALS Care application.
Thank you.
Thank you. Any more questions? Okay. Okay. It's already given by criteria. Mr. Boj had asked, I want to know the criteria needed during picture taking for weight estimation. Already answered by
Yes.
Dr. Sambhavi. And thank you very much for the opportunity offered. It is indeed helping us out as vets. Okay. Kindly include the mode of application. IM, IB, subcut, topical on the dosage platform. It is already yeah. It is already
Present.
Present over
So,
there.
Mr. Filbert, thank you for your question. And the question you have asked for including the mode of application, it is already included on our updated application. So, if you already have the application, you can update it, and then you can get all the IM, IV, and subcut application modes mentioned with the drugs.
Okay. And how can we measure animals' body weight by using we are developing this
Yes, we are
Yeah.
on the
application, and sooner we'll get this application in our ALS Care application. Right?
Can you share the lecture materials for us?
You have
We will share a lecture material, PPT, with all the participants. But I request everyone to download this ALS Care application, and which would be very helpful for you for your daily usage in the field. Right?
Okay, and then the webinar we have just conducted or the future webinars will be present in the notifications that you will get in the ALS Care app. From there, you can download the material, study the material, and then share the knowledge with other people as well.
Okay, Mr. Benson, anything from your side? You want to say something? So we can conclude. Yeah.
Yeah, from me, I think just grateful that this had to happen. And I must thank all the participants for taking their time. Nobody has free time on earth. Everybody is always doing something at some time. And therefore, for the participants to be here with us, I think we thank you so much, and we hope that we will continue interacting with you, engaging with you, and always remember that we are available at whatever time. Please feel free to contact us for any information at any time. Thank you very much. For the ALS team, the technical team, again, thank you for the work you have done. I know there's a lot that has been going through at the back of the curtain. So many things happening, so many people connecting the wires and so on. So thank you so much. And again, keep up so that next time we do it even better. So thank you very much and have a good day, good afternoon.
Thank you.
Good
Thank you, Mr. Benson. We are here to enrich our veterinarians and paraprofessionals for their daily usage. And yes, we are committed to do that. Sooner that application will come in our this ALS Care app.
Thank you.
So I want to invite Dr. Sumit to deliver the vote of thanks to our esteemed guest, Mr. Benson. And yes, so he has talked about the presentation in a very beautiful manner. I hope Dr. Sumit will do the justice with word of thanks. Over to you.
Thank you, Dr. Sambhavi.
Mr. Benson, you have shared very relatable experience on the how to overcome common challenges faced by veterinarians such as dosage calculations, record keeping with the help of ALS care apps. We would like to extend our sincere thanks to each of and every participant for joining us today. Your dedications to learning and improving veterinary practice is highly appreciated, and it is professionals like you who are shaping the futures of animal healthcare systems. A very special thank to Mr. Benson for delivering such an informative and inspiring session and for introducing us to the innovative ALS care apps. The tool demonstrated today includes My Clinical Assistance, dosage calculators clearly show how technology can simplify workflows, enhances accuracy, and support better clinical decisions. In today rapidly evolving veterinary fields, adopting smart digital solution is essential. The ALS Care app empowers veterinarians and farmers to improve efficiency, optimize time utilizations, and elevate the standards of care across the multiple species. We truly hope this session has added value to your professional knowledge and inspired you to integrate this advanced tool into your daily practices for better outcomes. If you have any questions or need further any assistance regarding ALS Care app, please feel free to reach out to us. We are always here to support you. Once again, thank you to all our participants for your active involvement, time, and commitment to advancing veterinary cares. Thank you so much. Have a wonderful day ahead. Thank you so much.
Thank you, Dr. Sun.
Thank you.
We'll conclude this
Thank you
session.
and bye-bye.
Thank you very
Thank
much.
you very much. So we will end today's session. Thank you very much once again for all the participants who have joined across the world. Thank you so much. Have a good day. Thank you so much.